Hi everyone, Dr. Melanie Crites-Bachert here with 360 PHI and the Center for Men's and Women's Urology here in Portland, Oregon. Thanks for joining me for another segment of Ask Dr. Crites-Bachert. So what I want to talk about today for this segment is something that's very common to a lot of individuals, recurrent urinary tract infections. Most patients, when they come to me, they say, I've tried everything, I've been on and off of antibiotics, I just can't seem to kick this. In some instances, it's irritative bladder symptoms that mimic urinary tract infections, in which case that's something for a different segment. But if you actually do have recurrent urinary tract infections, and the caveat is these have to be culture confirmed, meaning that the urine is actually sent for culture and it comes back 48 hours later with either growth of bacteria or no growth of bacteria. Sometimes there's contamination, but for our purposes today, we'll talk about either growth of bacteria or no growth of bacteria. So, if you have these recurrent urinary tract infections, this is something that's very common among young sexually active females, males, and even older males and females past the age of menopause and men with enlarged prostates. So having said that, when you go and see your doctor, the first thing that we're going to want to do is we're going to want to try to get to the bottom and identify if there is a cause for these recurrent infections. Meaning, we're probably going to put a camera inside your bladder and take a look around. We're going to order imaging studies in the way of a CT scan or an ultrasound to check what we call your upper tracts, meaning your kidneys, the things that we can't see when we put the camera in the bladder, to see if you have stones there. The other thing that we may or may not do, depending on your symptoms, is do a vaginal swab if you're a female or a urethral swab if you're a male. We want to also do physical exam, check the vaginal tissue in ladies to see if you have thin vaginal tissue that is irritated or inflamed, because that can predispose you to recurrent infections. Or if you're a male, if you're uncircumcised, is there a problem with the foreskin? Or do you have an enlarged prostate? Basically, we're going to do some studies to try to figure out if there's an identifiable cause that prevents you from actively emptying your bladder or effectively emptying your bladder, or if there's something that's awry with your anatomy. In absence of all of those things, if it's just recurrent urinary tract infections and you truly have no identifiable cause and it's not associated with sexual intercourse, then maybe we need to take a look at the bowels. We want to check and see if you're having episodes of bowel leakage or fecal soiling. That's also a very common cause of recurrent urinary tract infections. And not to get a little uncomfortable here, but one of the questions that I always have that a lot of folks don't think about: are you using sexual toys? And if you are you cleaning them properly? Are you having anal intercourse followed by vaginal intercourse? That's a very, very common cause that a lot of folks don't think about. It's not first thing on their mind, but certainly can cause contamination and soiling. So let's say, for all intents and purposes, that we've not identified one single contributing factor that might be causing these recurrent infections. Let me tell you about some things that we start with here in our office. And if you're planning on seeing a physician because you think you have recurrent urinary tract infections, these are some things that you can go ahead and start just in the comfort of your own home. You can get any of these substances. They are naturopathic supplements that we use. You can get any of these things at any health food store, or I have patients tell me that they get them off of Amazon. Now, what I mean by health food store, we're talking New Seasons, Whole Foods, Natural Grocers, or if you have an herb shop in town, certainly go and check out the herb shop, see if they have these substances there. Each of these substances acts in a different way to help prevent urinary tract infections. The first one that we talk about is cranberry. A good cranberry supplement helps to acidify the urine to help make a less hospitable environment for bacteria. we use d-mannose. Now, that substance is a sugar by chemical composition, but not actually the sugar that we think of that we eat by mouth. Basically, what that does is helps to rebuild the lining of the bladder, which is also comprised of a substance called glycosaminoglycan, which is also a sugar by chemical composition. The d-mannose helps to fortify the bladder lining and rebuild it so that it's impermeable for bacteria. Another substance that we use is called berberine, and berberine has been shown to basically act as a natural antibiotic against a couple of very common pathogens or bacteria that cause recurrent infections. We also use probiotics, which are natural lactobacillus and other good bacteria to put that good bacteria back into your system, because as we all know, antibiotics can cause a disruption between the good and the bad bacteria. While it kills the bad bacteria, it also can deplete the good bacteria. And thereby allowing other bad bacteria to overgrow. So we always like to add that good bacteria back to the system. So a good, strong probiotic, and it'll also help the bowels if you have some bowel irregularity. We also, in postmenopausal females, we also like to use a vaginal estrogen cream or some other vaginal substance, whether it's a natural compounded substance from a compounding pharmacy, to help reduce the inflammation in the vagina that can predispose to urinary tract infections. So having said all of that, you can go to 360phi.com. You can see the algorithm that we follow for treatment of urinary tract infections to get to the bottom of actually what's going on. If you have any other questions, certainly, we're happy to answer any questions that you might have. Send us an email. You just might find your question on the next segment. Thanks so much for joining us today.